Good afternoon, everyone. Welcome to the Countdown webinar, Rethinking Antibiotics at Drying Off. My name is Louise Sunderman. I am the Program Development Manager for Animal Health Fertility at Dairy Australia. I'd just like to introduce our speakers for today. We've got Mark Humphris, is a dairy vet and consultant based near Maffra, Victoria, and is the project leader for the Countdown project. We also have Brian Corr, who is a dairy farm manager for DFP Australia, managing their Poowong and Athlone dairy farms. Just some quick housekeeping before we get started. If you do have any questions, please write them in the comment box below as you think of them. We'll try and address them at the end of each of the presenters' presentations. If there are any questions that we don't get to today, please don't despair. I will take them down. We'll get some responses from the presenters and send them through to all registrants. Today's webinar is also being recorded, so if you have to step out, you will be able to catch up afterwards. I will send the recording link through to all registrants once it is online. So I might get started. Welcome, Mark.
Thanks, Louise. I'll just click through here. So our aim today is to stimulate thought, discussion, and, where appropriate, change to some of your practices with dry cow management. It's really not possible to cover everything about dry cow management in less than an hour, but we hope that the discussion provides some good context to the changes to dry cow management that we have seen in other countries, as well as a good reminder of the opportunities with improving dry cow management to set up our cows for the next lactation. The webinar will be split up into three sections. Firstly, a discussion on antimicrobial resistance and what it means in our dairy farming context, a discussion of the critical aspects of managing the dry period, and then we will talk about part herd or selective antibiotic dry cow therapy and use Brian's farm or farms as examples where this has been implemented. Just by way of starting, if we could just respond to the following poll question on your phones or computers. What role do you have in the dairy industry? Thanks, Shona. Just give you some time to respond there. Okay, thank you very much, Shona. The following is a quote from the Chief Medical Officer in the UK, Professor Dame Sally Davies. Antimicrobial resistance poses a catastrophic threat. If we don't act now, any one of us could go to hospital in 20 years for minor surgery and die because of an ordinary infection that can't be treated by antibiotics. And routine operations like hip replacements or organ transplants could be deadly because of the risk of infection. Although her views are deemed by some to be extreme, she holds the highest position in the UK medical system and advises organisations such as the UN General Assembly, G8 Science Ministers Meeting and the World Health Assembly. Further, on current projections, modelling has been done to estimate that antimicrobial resistance will lead to the deaths of over 10 million people per year. That is more than the deaths of all the different cancers combined. So the message here is antimicrobial resistance is real and we need to understand where we can make a difference. Whether it is that dramatic can and will be debated, but it's important to know what people are saying. At least in our dairy industry, we're not known for our excellence in PR management, so we need to make changes when we're able to. Scientists and politicians will continue to debate the links between antibiotic usage in animals and antimicrobial resistance in humans well into the future. However, regardless of these arguments, we all have a responsibility to do our bit, whether we're a farmer or a veterinarian or a medical doctor or a patient. So how does our country fare in comparison with others with our antibiotic usage? This is older aggregated data that does need updating. You can see here that Australia has very low usage, but this is with all animals combined, and we have a lot of animals in our country that are raised in very extensive systems. So we can't read it at the bottom here, but this is antibiotic use in milligrams per kilogram. So there's a lot of different ways to interpret this information. But you can see here that at least in this list, we measure favourably, but we can always do better. And what's becoming obvious is that if we do better, it increases our competitiveness, at least with some markets. But this relies upon more accurate recording and reporting to our countries. Many of you would have heard the term antimicrobial stewardship, and there will be many definitions, but antimicrobial stewardship is a critical part of reducing the risks and rate of antimicrobial resistance development. One descriptor of antimicrobial stewardship, or AMS, is to use antimicrobials appropriately, such that the next generation will inherit them with the same effectiveness, but not at the result of increased disease in our animals. And can also be captured by the following statement: using antibiotics as little as possible, as much as necessary. I'm certainly not saying that we don't want them to be used, but just that they need to be used wisely and where required. I should share the example in Denmark. When they moved away from whole herd antibiotic dry cow therapy, there was actually an increase in strep mastitis, a stark warning to us all. So on review of this, it was found that there were breakdowns in how cows were being selected. So there are things that we have learnt but need to relearn as vets and farmers about overall dry cow management. So on our dairy farms, there are some key areas that most farms could improve their use of antibiotics. Firstly, clinical mastitis treatments. Knowing when not to treat is sometimes hard, but unfortunately, there are many cows that should not be treated again because of their obvious chronic history or an incorrect diagnosis of mastitis. We know that cows with previous high cell counts, when multiple quarters are infected, even hindquarters as opposed to forequarters, or when mastitis occurs later in lactation, all reduce the probability of cure. Later in the year, we will host another webinar talking about clinical mastitis, but the practice used on some farms to treat subclinical mastitis cows during lactation is flawed and a good way to burn a few more dollars for no benefit. But we'll discuss that at another webinar. Similarly, certain practices in calf health and lameness need urgent attention on some farms with how antibiotics are used. And then there is dry cow therapy, which is the topic of the day. So, wrapping up, brief discussion on antimicrobial resistance and stewardship. Antimicrobial resistance is real. Regardless of the length, we have a shared responsibility to act, and that there are opportunities that exist to optimise our use of antibiotics. So with the discussion about antimicrobial resistance providing some good context, I'm going to review the critical elements of dry cow management before moving to discussing part-herd antibiotic therapy. I always find it useful to go back to what we're trying to achieve with the dry period. We want to use our husbandry and routines to send a signal to cause a reduction in milk supply and an abrupt ceasing to milking to cause udder involution or shrinking, to then allow new udder cells to grow again in preparation for the next lactation. We want to treat any subclinical infections that are present, but also new infections during a very high-risk time for the cow, being the dry period. Antibiotic dry cow therapy has been successful in achieving both these objectives, but now we have internal teat sealants that do nothing for treating existing infections, but are equivalent or better than antibiotics if administered properly at preventing new infections. In many herds, our mastitis control has progressed where at the end of lactation there are not as many infected cows. So with these cows, we don't need to treat the existing infections, but we certainly need to prevent the new infections. But we need to do this and achieve this without any antibiotic violation. The shared responsibility of vets, farmers, pharmaceutical company representatives to keep antibiotics from the bulk tanks is critical. Our testing systems are very good to prevent any antibiotic going further, but the waste of contaminated milk which needs disposal is not something many of our dairy businesses can sustain. We need to support better practices such as developing batch lists for drying off and working out when the cow's milk is safe for consumption after calving. In this graph here, we can see that the high risk time of new environmental bacterial infections is in fact after drying off and around the time of calving. In one study, approximately 50% of the clinical cases from environmental pathogens occurring in the first 76 to 100 days of lactation were of dry period origin. And some people might say, well, why is the dry period high risk time? Well, we're stopping the removing of milk. There's no flushing action. There's actually reduced white cell function. We're stopping post-milking teat disinfection. In fact, the anatomic changes to the teat canal get shorter and therefore a little bit riskier for bacteria to get in. And on top of this, the formation of the natural keratin plug has studied and shown that for some cows there is delayed keratin plug formation, which necessarily increases the risk of mastitis. From this table here, from numerous studies have been fairly consistent that even after 10 days of drying off, half the cows, or half the teats in fact, are still open, and even by 6 weeks after drying off, up to 20% of teats can still be open after drying off. This research and our own experience tells us that if some cows at dry off do not receive an antibiotic, for many farms and situations, the cow will still need an internal teat sealant. So how do we know if we've done a good job at managing the dry period? Well, firstly, there's no cases of clinical mastitis in the dry period. Even if there's one case of mastitis in the dry period, it points the finger directly back at the management around the time of drying off. The next indicator is your calving time mastitis, which is the clinical mastitis in the first 14 days after calving. And I can make this guarantee today that I can guarantee that every dairy farm in Australia can have less than 5% calving time mastitis. And if you'd like to take me up on that guarantee, get in touch. And also, there's no antibiotic residues in the bulk tank after calving or after cows re-enter the milking string. But why is there such variation between farms with these measures? You could have 5 farms that are doing the same thing, in inverted commas, but are achieving very good results. And really, so that prompts the discussion of some of the critical aspects. Farms that achieve very good mastitis control have developed systems that optimise their use of antibiotics. By going through the different management that we need to strive for, hopefully we'll be able to see that the product is only one small component of getting it right. Firstly, we need to have the right cow, to dry cow. Cows with chronic high cell counts or cows with repeat clinical mastitis are very unlikely to respond to the process of drying off and any products that are used. And we've got to get the timing right, which absolutely comes back to early pregnancy diagnosis. So detecting pregnancy in 6 to 16 weeks of age, to then be able to generate accurate dry-off dates. And it certainly involves accurate cow identification and not having double-ups and things like that. And then getting the production right. Just a screenshot from one of our farms that showing the cell count, the most recent cell count and the milk production. We know that as milk production increases over 12 litres, that it increases the risk of clinical mastitis in the next lactation. And the other thing we're very aware of is that in cows producing less than 5 litres, where the udder is already undergoing the process of drying off, that if an antibiotic is being used, it is of much greater risk of antibiotic violations because the antibiotic's not being absorbed by a larger amount of tissue. So getting the steps right to send a signal to that cow to reduce production to the right level is important. Getting the right products, which we'll talk about in the next section. But certainly the technique, and this is probably one of the biggest areas where there can be great variations on farm. We need to be able to have the right people doing the job with the right hygiene and attention to detail, good marking and recording, using the appropriate disinfectant, 70% alcohol to clean the teat ends, and restrain the cow in order to do it properly where required, and getting that teat end, not necessarily the barrel, but the teat end very clean before administering the dry cow products. So Shona, if you could just play that video, it's about a 1-minute video, which is a thank you. We can play there. So having some good hygiene and just this countdown video showing that we're really trying to scrub the end of the teat as much as disinfect, but scrub as well. And very careful when you're removing the cap to not contaminate the end of that sterilised tube, and then at least aiming for partial insertion of that antibiotic and then massaging the quarter. And if you're administering an internal teat sealant, pinching the top of the teat and then aiming to just insert that into the teat canal as much as is possible, and doing that across the 4 teats and then teat spraying. Thanks, Shona. And then also having an environment around drying off where cows are not in heavily contaminated areas, even more importantly after the drying off, and being away from the dairy and not returning anywhere near the dairy. Even in this picture here of one of Brian's paddocks, you can see here that it's not very contaminated. Yes, it's dry, but there's very good drainage. It's not supporting bacterial. That could be an appropriate place where you could feed some dry feed, at least for a short time, after calving. So it doesn't have to be all exceptionally clean, but but compared to, say, something like this where the farmers try to fence off the trees, we've got a highly contaminated area here, and if that was either cows after drying off or before calf, it's very, very high risk to those cows, and regardless of whatever fancy products you use, they're going to have a lot more mastitis in the subsequent lactation. So then and having the right monitoring afterwards, and during that dry period for any cows that are in trouble or that might get mastitis, and then moving towards generating a cow ID order list for milkers to check before they actually, when the cow calves, to ensure that the milk is safe for human consumption. So a very quick run through that I suppose provides hopefully the breadth of the controls that many of us strive for, but need further work. Countdown has developed a a very basic two-page website called the Dry Cow Consult that acts to stimulate discussion when talking with your veterinarian about making improvements every year to your routines, and the website address is up the top. For many farms, improving dry cow management is still the area for greatest improvement for mastitis control. Although there is a lot of dry cow antibiotic currently used, there is so much to be gained by improving other procedures at trials other than the actual product. So if you think about the amount of time that a cow's in the shed, she's in the shed for about 8 to 10 minutes a day, a couple of times a day, and you compare that amount of time with the time that it should take to dry a cow off. If you're doing it much faster than 3 minutes, you're probably not giving enough time to do it properly. It really, if it's worth doing properly. And certainly at this point, the risk or consequence of not doing it properly is certainly great. So the key messages from this section: improving dry cow management is crucial to controlling environmental mastitis and taking an opportunity to treat contagious mastitis during the dry period. And for most farms, improving aspects other than product will lead to the greatest improvement.
Mark, okay, I'll jump in and ask a quick question, two questions from the group. So Claudia asked, how do you know if there is a mastitis case in the dry herd? Are you able to quickly answer that before we keep moving?
Yes, just through observation of that dry cow where she's in the paddock or where she's being housed, to identify any swollen quarters or that she may be away from the group or not with the group and not coping, so you can identify those cows if they're sick or swollen quarter.
Just another one quickly from Jenny. Is there a high incidence of SARA or full-blown ruminal acidosis found in these cows that are suffering mastitis during the dry period? No, that's not the feature. They don't have the on many dry cows probably won't have access to concentrate feed, and so acidosis is not part of that presentation. Yeah. Okay. Thanks, Mark.
Okay. So moving forward to discussion around part herd antibiotic therapy. Just if we could have that second poll, Shona. If you work on a dairy farm, what dry cow practice do you currently use? And of the three options there, do you use an antibiotic dry cow and internal teat sealant on all cows at dry off? Or do you use a combination of part herd antibiotic and part herd internal teat sealants, or no use of dry cow products at all? Okay, thank you. We'll move forward. So in 2008, when Dutch legislation came in to ban or prohibit the use of whole herd antibiotic dry cow therapy, I was initially affronted that someone thought that they could just take away one of the cornerstones of mastitis control that we've used very successfully for years. But when you take a step back and look at what we are doing, plus what can be achieved without it, I considered it in a different light. Now, the UK and other European countries are following Holland's lead with incentivising part-herd antibiotic dry cow therapy, where antibiotics are only given to those cows where there is evidence of an infection. And some milk companies in these countries are penalising producers if this is not done. Changes to how we live cows in the future will be one small part of our responsibility towards preserving life-saving antibiotics. And closer to home, in New Zealand, the New Zealand Veterinary Association and dairy cattle vets have made a statement that by 2020, dry cow therapy will only be used in the treatment of existing intramammary infections. So I'd just like to reintroduce Brian, who operates a couple of farms in South Gippsland. Brian, use that. And ask Brian to tell us about his experience in the last couple of years with managing dry cows. But I've just got a few photos of his farms here. But if you could start, Brian, by telling us a little bit about your farm and how the farms have been put together.
Yeah, so like a couple of years ago, we were meeting autumn calving, about 70% autumn calving, and we started the transition quite late in the season over to 100% spring calving. And in the rush that it was, trying to get cows together and to put a whole new herd, not entirely a new herd together, but probably 80% of the cows were new cows or new heifers. We ended up purchasing quite a few cows that probably hadn't been dried off properly, and yeah, therefore brought in quite a few issues that we hadn't had previously. Which previously we hadn't really been having a lot of mastitis issues. But we actually brought those issues in, and when you buy from multiple herds, you buy in multiple problems. And so it really made us have to stop and think about what we were doing. That first calving, we would have spent quite a bit of time and money treating mastitis as a result of the cows that we bought in. Yeah.
Thanks, Brian. And just some more pictures here of your farms and calves. So why did you consider and then implement part-herd antibiotic dry cow therapy?
So I suppose, like you said earlier, Mark, one of the things that I didn't like the idea of treating a cow that clearly didn't have an infection. So I just felt we have a duty of care to make sure we're not overusing antibiotics, and to ensure that there are some antibiotics left in the future that are still going to work. Also, that first season when we changed over, just the amount of time that we would have spent in treating mastitis and the amount of money that we spent treating it. Yeah, we really needed to ensure that there was going to be drugs to treat our mastitis in the future. So if we continued along the same path, we were probably going to run out of drugs and really cause ourselves some issues. I suppose that the last issue would have been a lot less chance of having antibiotic residues if you're using less of them. If we can hopefully get to a stage where we're probably getting down to less than half the herd getting treated, it will make a big difference in that regard.
All right. Thanks, Brian. So what do you see? So what do you see as the risk with using part-herd antibiotic therapy?
I suppose one of the major risks would be that you don't have good mastitis control in the first place, and probably needing to have really good records of what mastitis and clinical cases you've had previously. Also, if you're going to use teeth sealing without antibiotics, there's a greater risk of infection during the dry period because you haven't used any antibiotic, and you have that chance of probably causing the infection by doing the teeth sealing itself.
Okay, thanks. So now, Brian, what makes your herds now suitable for part herd anti-trichow therapy?
So in the last couple of years, we've worked pretty hard to record, or to ensure that we've recorded all treatments in detail and what drugs we've used, and to, I suppose at the start, 2 years ago we weren't herd testing. Now we're doing at least 4 herd tests per season. That's got us to a point where our older herd has a cell count of less than 220 pretty much all year round, and our younger herd is under 100. So
even with them once a day.
The younger herd is on once a day for probably 1/3 of the season. They're on once a day right now, with about 2 months left to go before dry off, and they're sitting at around 120 right now. So we've had much lower cases of clinical mastitis this year compared to last year, and a huge reduction compared to the first year. And just, I suppose, the ongoing discussions with our vets on how we transition to that point, and making sure that we're clear and we know what we're doing. So last season was the first time that we actually decided that it would be a good idea to get some help with staff training on the dry cow infusion process. So we actually got Mark in for half a day, or at least 3 or 4 hours. Mark came and helped us dry off some cows, and did a short classroom session with all the staff and showed them the proper technique, and then went out and showed them it in practice, which seemed to really help. It's a very long process to do it properly, but I think the staff could see that it was going to reduce the workload during calving with less clinical cases, and overall it was going to reduce the workload, even though it would definitely took us probably 2 to 3 times longer to do it the correct way, after we'd been shown that we probably weren't doing it 100% right.
Thanks, Brian. So how have you decided what cows receive which products?
And so we set the rules at any cows with a cell count of under 150,000 would be suitable for just teeth sealing, and any cows over that we would just continue on with what we had previously been doing, which was dry antibiotic plus internal teeth sealant. The second part of the criteria was that any cows that had any cases of mastitis, any clinical mastitis for the season, would just be continued on as normal on dry cow antibiotics and teeth sealant.
Okay. Thanks, Brian. This is just a picture of the process using some drums filled with water, and people tail-jacking where required, so that it can be administered hygienically. And certainly the hygiene around it, as Brian has said, is just an absolutely critical component, whether you're using an antibiotic or an internal teeth sealant, because the consequences for not getting it right are great. I think what Brian and I have agreed, at the moment it's a process of, whilst we've had some really good results, I think it's a process of building our confidence in in using this a new approach, I suppose, to dry cow management in these two herds. And there's research, currently research being done within Australia, and also sizable, a significant research project just finishing up in New Zealand, which will soon get greater detail that will continue to inform our decisions, I suppose, as seasons progress and our confidence builds. We do understand that in the future we might be raising that level of the sort of the threshold, or looking only to more recent herd tests rather than the whole every individual cell count for that lactation. So, and similarly with looking at how recently a cow has had clinical mastitis and whether she's shown evidence that she's responded. So that's and whether she's shown evidence that she's responded. So that's I think it's part of the journey, and as we get more research results and more experience, I suppose we'll change through that ongoing discussion. So in summary, part-head antibiotic therapy, it's certainly through consultation with your veterinarian, it may be suitable for your herd. The countdown, we've got a whole bunch of resources, tech notes. I think some of the co-authors of the updated Tech Note 14, which is the dry cow one, are online today. We've actually used mastitis focus reports in Brian's farm to, I suppose, demonstrate the increased control that we've got, and areas for improvement. There's the sheep guides and videos that you can use. I showed you a snapshot of that today. The app, the dry cow console, as we've highlighted, and also for countdown advisors and farmers that want to have a dry cow discussion session, there is resources available for that to happen in your area, so that you can have a lot longer discussion about some of the aspects of dry cow management. Furthermore, Countdown has produced a new, yet to be published, but Fact Sheet C, which is the guide to choosing an appropriate dry cow treatment strategy. Now, this is in the final stages of design, and through your registration for this webinar, we will follow up and email this new Fact Sheet C when it's published in a couple of weeks. So that'll be sent to your email. So we've done well for time, but I'm sure I haven't looked at the questions yet, but I'm sure we'll probably have a few questions. Louise?
So we've just got one from Joel. Mark, have you examined herds that have low bulk meal cell count / mastitis incidence and use no dry cow therapy, and what did you find?
At least in the farms that I work with, we haven't been, I haven't been involved with those farms. It's a good question. I suppose that so if you're achieving very good outcomes in terms of the bulk milk cell count and clinical case rate, it would depend on the environment in which the cows are going into, both after drying off and before calving, as to the risks. If I was to describe, in an uninfected animal, if I could describe a perfect situation where those cows go onto sand, where sand doesn't support any bacterial growth for the dry period, well then, yes, you won't
most of the time you wouldn't need an internal teat sealant because the level of challenge to that teat after drying off and before calving is going to be very, very low, and so you wouldn't need a product. We had the discussion yesterday about in Brian's environment, if we go back to an example where in South Gippsland, calving in July, August, September, normally there's large amounts of rain, and we've got pretty much over 1,000 cows, two farms calving very quickly. We've got a high challenge situation, both in terms of the environment, but also in terms of the amount of fecal challenge to the teat end. And in those situations, it's always driven by the manager and the owner of those cows, but it would be too high a risk in those situations to enter into that without an internal teat sealant. Would that be fair to say, Brian?
Definitely. With we do have a calving shed at one of the farms, and although that does shelter them from the rain, it does concentrate the pressure into a smaller area. And we have had even greater difficulties with the calving shed than with cows calving outside. But last season, I suppose the July and August were really good months for us, but September turned out to be really, really wet, so you can't really judge how good the weather is going to be during calving, and therefore the risk. So if you can try and lower that risk as much as possible, and I think teat seal is a perfect example of how you can do that without too much cost and without any chances of any antibiotic residue.
All right, thanks, Brian. Yeah, so I suppose I moved that question a little bit, but hopefully that's answered at least, or I suppose raised some of those issues surrounding that question.
Thanks, Mark. Just another one from G. In cases of strep ag, blanket dry cow therapy is recommended. Is that a question, G? We'll put that as a question. With strep ag cases, is it recommended to use blanket dry cow? Your thoughts?
Absolutely is the short answer. Some of the factors that through consultation with your vet is an awareness of the types of pathogens that, the types of bacteria that are causing mastitis or high cell counts on your farm. And strep ag is certainly one of them where absolutely you need whole herd antibiotic dry cow therapy, and that's captured through the dry cow salt discussions and also through the soon to be published fact sheet C.
Thanks, Mark. This one for Brian from Ross. How has putting cows on once-a-day milking affected your bulk milk cell count?
Oh, for Brian. Sorry, what was that?
I'll repeat it for you. How has putting the cows onto once-a-day milking affected your bulk milk cell count?
So we've only done that this year with our younger herd, which were at that farm we calved down half heifers and half second calvers this season. So throughout the season we've sort of sat somewhere between 60 and 80,000, and yeah, that's it. It's less than doubled, but it started from quite a low point, so to be consistently under 150,000 still, and quite late in lactation hasn't caused us any issues at all.
Okay, great. Thanks, Brian. We've got another one from Casey. To clarify, was the 150,000 cell count cut off through the whole lactation or through last test? I think that was for using. That was for you, Mark?
Yeah, so I can answer that one.
Great.
So this season we've decided that we're going to keep it. It needs to have been under that for the entire lactation. But like Mark said, in the future we possibly will look more closely really at just the last test. but I'm sort of waiting on some more information to come out about the accuracy of that. Yeah.
Thanks, Brian. We've got another one from Jackie. Do you have any thoughts on looking at increasing the cow's natural defence system to bugs, i.e. her immune system, rather than reliance and focus on antibiotics to treat an infection? Mark, I'll leave that one for you.
Thanks, Louise. I think that's, it's really certainly part of everything, I suppose, we're endeavouring to do with the nutritional management of cows. The immune system is better supported in cows with good nutrition. It's better supported when you've got people that are managing the cows, that move cows well, they handle them appropriately. It's absolutely, but in terms of going to the next step of being able to achieve treating existing infections, I think we're learning more about the level in which we can use internal teat sealants alone. Research within Australia is testing that, and research in New Zealand is testing that. I'm sure that in 5 to 10 years there'll be more information that comes to light that we're in a position where we've got more diagnostics about the type of bacteria that's causing that infection and whether that on average can self-cure compared to others that, like many of us know, infections like Staph aureus are very unlikely to self-cure and require antibiotics. But other pathogens, other bacteria, we're all mastitis researchers and industry are talking about the need for diagnostics at the time of drying off to more accurately, and this is looking further and further into the future, more accurately understand the type of bacteria that's present in the udder. And I'm sure there's a lot more to learn. And also, I suppose, individual quarters, where individual quarters may be infected, and there is a lot of eager scientists that some have funding and some others don't, that we need to be able to support to improve cow-side tests as we go further into the future. But I suppose this progression is just part of a journey, and that we're endeavouring to manage our cows in a way that reduces the bacterial challenge and enhances their own immune systems to deal with it. So I think that's a fairly long-winded answer, but to have a go at answering that.
Thanks, Mark. Hopefully that helped. One from Claudia. How is the clinical mastitis rate measured, and what is the acceptable figure to see if what we are doing is working?
Okay, to go back to that indicator of how both the dry cow management and the calving time management has gone, the rate that we talk about there is calving time mastitis. So that's the amount of clinical mastitis that you can count in the first 14 days after calving. So if you had 100 cows that calved and 10 of those cows had mastitis, clinical mastitis, within the first 14 days after they calved, the individual calving date, your calving time mastitis rate would be 10%. And back on that slide, I suggested that in every farm in Australia, it's possible to achieve less than 5%. clinical mastitis, calving time clinical mastitis in the first 14 days. I hope that helps a little bit.
Got another one from Joanne. How close should the last herd test day be before dry off?
It's a good question. At the moment, through given research in New Zealand, we've set that expectation, if I refer to fact sheet C, as 80 days. The herd test should be within 80 days of the dry off date. Obviously, that still allows some risk that cow may have developed subclinical mastitis in between that stage. But again, what we're learning, and probably is in too great a depth for this webinar and to be discussed with your vet, but what we're learning is that if there's some cows that are missed, as long as the process is done very hygienically and those other factors have been covered off with dry cow management, that missing the odd infection, and when you're only using an internal teat sealant, there is a higher rate of self-cures. So this is sort of on the edge of the research really that you're asking, and I think we're fortunate that there's research continuing in Australia and New Zealand that hopefully will keep you abreast of.
We've got one more, Mark. What is the optimum dry off period to confirm the antibiotic withdrawal?
It's related to the withhold period of the product that you're using. So there are two sort of classes of chemical and antibiotic that are used, and mainly they have a minimum milk withhold of 35 days or 49 days, and I suppose that's all needs to have thorough planning, and that's why it's just so critical to spend the time with your vet planning, because you can sort of, from a distance, you can say, well, maybe that antibiotic or that approach will work on that farm, but there's so much planning that's required to understand I suppose the level of detail, the level of accuracy, the level of predictability of calving dates, which is influenced by a whole host of things like when the preg test was done, did the preg test, cow IDs, and the amount of information going into AI or bull matings and things like that. So yeah, and that's why it's not something that we'll cover here today in terms of the types of antibiotics, because that's certainly a discussion with your veterinarian. I hope that's answered in some way, but certainly in the two classes, 35 days or 49 days, obviously the dry period needs to be more than that. And we've looked at it more recently with the review of the Tech Note 14, but it certainly appears as though the optimum time to provide cows in terms of a dry period is in that 6 to 8 week period. I have my own personal opinion on that, but that's the evidence is that any time between that optimises that time for the udder to shrink and involute and then generate new cells. for the next lactation.
Okay, we might wrap it up there. Thanks again, Mark and Brian, for your presentations today, and thank you for everyone to joining in. Please keep an eye out for future webinars. There will be a few more coming up this year from Dairy Australia on topics like using antibiotics, but then also on other topics to do with your farm. Once again, thank you very much.
Thank you, Brian.
Thanks.